Hello, everyone. My name is Jacob Range, and this is my practicum project for my RN to BSN. So I did my practicum in the cardiovascular ICU at the University of Kentucky, which is on the 8th floor. So I did my practicum project on early ambulation and mobilization in post-op cardiac surgery patients and the benefits of those. It was really cool. Those patients are recovered from the OR directly to the ICU. And so different target groups were people who've had a CABG, pacemakers placed, VADs, or heart valve replacements, or heart lung transplants. Those patients that were not included in like benefits of having early ambulation or mobilization due to the risks outweighing the benefits would be people that were like on ECMO or had balloon pumps and stuff like that. So my learning objectives were I want to know why is this such an important and critical intervention for early ambulation and mobilization post-op cardiac patients. I learned the different techniques on how to ambulate patients and why it was important to be ambulating and mobilizing your patients. I did this through talking with the different cardiac ICU nurses on the unit, along with my preceptor, and working hands-on with these patients. And then I was also reviewing literature, making sure everything was matching up with what was going on the unit. So just kind of a brief overview of what was going on in the unit. I worked nights, so I did my clinicals that night. And so when we first got there, we would tuck the patients in, get them settled in for the night. And I would discuss different things with my preceptor. And after we get my patients taken care of, I would go around the unit, learning about a variety of different patients. And I would talk with all the ICU nurses and ask them different questions regarding mobilization and ambulation of their patients and what was going on with their patients and stuff like that. And everyone was super helpful and friendly and was very responsive to me being there. And then at 5 o'clock in the morning, it was like clockwork. Everyone was up and we're ambulating, moving people's chairs and doing range of motion exercises. Every morning at 5, they do that. A couple of the nights I was there, they had a mobility nursing tech, which they were kind of designated to go around the department, make sure everyone was getting up and ensuring that everyone was getting up and ambulating, getting to the chairs and doing all their mobilization techniques correctly. And literature has shown that implementing programs like this is where they designate a certain employee or person to ensure that all these ambulation and mobilization protocols are kind of taking place and everyone's getting up and moving is shown great benefits and significant reduction in post-op length of stay. Most patients were required to ambulate and move to chair 2-3 times a day. I didn't get to see a physical therapist because they come during the day, but they also come and help assess the patient and provide different interventions throughout their assessment and their skill sets. So why is this important? Cardiac patients have poor perfusion already. Them sitting in bed is not going to help improve anything. So getting them up, range of motion exercises and ambulation will help improve their blood flow and circulation. Most importantly, it's gonna help strengthen their lungs and their heart and since they already have poor perfusion issues, they're at high risk for blood clots, PEs, and skin integrity issues, and pressure ulcer stuff. And all the literature that shows that there's dozens of issues with patients sitting in bed and staying in bed and not getting up and moving. And main thing is get your patients up as soon as possible. Every ICU nurse that I talked to that went around the unit, every single one of them told me just get them up as soon as possible. There was no protocol in or anything like that. They just, as soon as you can get your patients up, get them up and moving. And all the literature that I was reading matches up exactly with that. It's up to nurses' discretion. If your patient's hemodynamically stable and can tolerate these exercises and stuff, you need to get them up, because that can get them out of the ICU quicker and get them home and feeling better. In hospitals that implement like mobility programs on their cardiac units have shown great success, and especially they save a lot of money, and just little things add up to make a lot of savings and improvements in patient care. Also, just be positive. Have a positive attitude around your patients. That's going to help them recover, and have them have a good mental attitude, because that is so critical and important with your patients, is ensuring that they are having a good, positive mental attitude. That's going to help them get better and feel better and get out of bed. No one likes sitting in bed all day. It doesn't feel good just to lay there and not be able to get out of bed. And after having cardiac surgery, being able to walk with your, moving down your chest and you just had your heart open, like, that's impressive, and that's going to help their mental health and their attitude. So just different techniques, just range of motion exercises, dangling their legs on the side of the bed, getting them up, standing, and pivot to the chair. With the ambulation, they would use what's called a thoracic walker, or at least that's what they called it, which is what's pictured in this picture here. It's just used to help stabilize them and give them some extra support. I didn't find any literature on the exact thoracic walkers or these walkers that are pictured. However, it's just to kind of help them get up and move better and be stable on their feet. We also walk behind the patients with a chair in case they get tired or unable to continue on. So also, most of your patients are going to be in sterile precautions, so that affects the technique of how they have to get up. They can't just push down on their arms to get out of bed. They have to everyone has a pillow, and they just kind of hold their chest to make sure that they don't use their upper arms, because they've had a median sternotomy, which that's how they get to the heart when they cut your chest open. So almost all of those patients had that going on. Some of the studies I was reading shows that complete restriction is not best practice, that to kind of use pain as your guide to the different activities, but also make sure that you keep your arms in. But main thing is you want to use your legs and try to keep your arms restricted. You can do some range of motion exercises, but use pain as a management and guide for that. So overall reflection, I love the cardiac ICU. I had an awesome experience. I really have been wanting to go up there. I love sick critical patients, and I've loved the heart. I find it very interesting. I'm an ER nurse, so I have a different mindset than the ICU nurses, and I really want to have that mindset. I think having both mindsets makes you a really well-rounded nurse. And I've felt uncomfortable around some of the cardiac patients, and now I really do feel a little bit more comfortable dealing with some of the cardiac patients. Along with, I've learned a lot about just making sure getting your patients out of bed and walking. In the ER, we always tell our patients, no, don't get out of bed. Like no one gets out of bed in the ER. I feel like, not just because we don't want them to get out, but oftentimes we just don't have the time. And it's kind of interesting just to see all these patients with like 4 chest tubes in and, on drips and on the monitor and just walking down the hall. It's kind of crazy and it's awesome. So the statement is best practice is to ambulate and mobilize your patient as soon as possible after having cardiac surgery performed in order to help patients recover quicker, along with a variety of other benefits, both physically and mentally. I really think the CVICU UK is up to date on best practices for mobilization of cardiac patients. They were doing everything that I was reading in the literature as well. The only recommendation, which they have on most nights, is the mobility tech, which is super beneficial and super useful, especially in any cardiac ICUs. That's really going to help the program. Is implementing that, having a tech or some designated person to go around. And even when there wasn't, all the nurses were working together really well, just because they knew how important this intervention was, and how beneficial it is just to get the patients up and moving. And lastly, make sure you're moving your patients and get them up as soon as possible. And thanks for watching. And that's a wrap. Appreciate everything for y'all watching. Here's my references. Thanks.